This is Starting Point, a podcast that tracks Guyana's unprecedented growth from all vantage points. Join your hosts, Kiana Wilberg and Fariza Hanif, as they dive deep into the heart of topical issues.
Hi there. Welcome to this week's episode of Starting Point. I am your host, Kiana Wilberg, and this week we place the spotlight on a very important subject: cancer. To help us understand this very important issue is Dr. Syed Ghazi, Director of Outreach at the Cancer Institute of Guyana. Dr. Ghazi, thank you so much for taking the time to sit with us today and to share some important facts about this important topic as well.
Thank you for inviting me, and I'm really, pleasure is mine.
So, Dr. Ghazi, I introduced you as being the Director of Outreach at the Cancer Institute. But I want you to tell me a little bit about yourself. Before we got started with this discussion, you shared a little bit with me about how long you've been in the medical profession, 43 plus years, and congratulations on that. But tell us a bit about who you are and what drew you to the decision to dedicate your life to this cause.
I'm a physician, as you said, and I have worked since long to help humanitarian organizations while I was in Chicago. I'm a Pakistani American coming from Chicago, and I used to help these organizations raising funds and used to go on international global missions like, Haiti. I have a group, Imana, this Islamic Medical Association of North America. They have an emergency relief wing, IMR, and we used to go to different countries like Sudan for cleft lip, Haiti, when the earthquake happened there. We did, and Gaza and Palestine and everywhere. So, but in 2014, I decided to move to Guyana to dedicate my life to help patients with cancer or people with whoever want to be screened for cancer, because I am with Cancer Institute since its inception, 2007. I was coming and going, doing outreaches, But 2014, because something happened in my family. I lost my family members to this monster, my sister, my brother, my nephew, and I decided to dedicate my life.
Well, I am so sorry for your loss.
To fight, I came here and then with Cancer Institute, I developed the outreach team, and until COVID, we did 3 years outreaches in hinterland, nearly in all regions, 1,000 women a year, especially for pap smears, cervical cancer. But I used to take my portable ultrasound machine and do the breast cancer screening also right there. So my life is dedicated to find, detect, test, and help people who suffer otherwise. That's what it is, yes. I do get other patients also. I see them also, try to help everybody. But, the main mission of my life is to help people with cancer. Because cancer does not affect an individual only.
Yes.
Cancer affects community, the family, your relatives. So we can't just focus on a person and, direct our help in any kind to that person only. We have to actually rehabilitate the whole family and, around the patient. That's my mission. That's what I'm doing. I have very good friends at Cancer Institute, my colleagues, and, and it is very satisfying to work because in Chicago I used to do fundraisers. You're doing fundraisers. You don't know where the money is going and how it has been spent. But when you do these things on a grassroots level, directly communicating with the people who need your help, it is very satisfying. It is spiritually, materially, I love it.
I'm grateful that this starting point of our discussion was offered us the opportunity to understand why you've dedicated your life to this cause, and we're really grateful that you shared that with us. So thank you. But further to this, Dr. Ghazi, you noted that you have been in the early stages coming to and fro Guyana, participating in different outreaches and so forth. What can you tell us about your outlook of how cancer treatment, outcome, the advancement of technologies and the expansion of expertise, what that looked like during your formative years of coming to Guyana, and what you see obtaining today?
Honestly, it's a big change. When I used to come earlier, when Cancer Institute is the only institution in this region, Caribbean region, which had radiation, we started radiation therapy, radiotherapy, treatment by radiation. There was no other organization doing that. And we were the one who focused on, because me and my friend George Nella, who is the founder of Cancer Institute, we saw patients here coming to us, or we used to see patients with, advanced stages of cancer. And it gives me a little pain to see them, they are being ignored, they are being, misdiagnosed, they're being sometimes in denial, and they don't want to come. And when they come, ultimately, it's too late. You can't save them, right? It's like sand in your fist, which is, slipping out, and you can't do anything. So that's when we started Cancer Institute. Cancer Institute itself have gone through a lot of phases, from having nothing there, but then now we have CT scan there, mammogram there, X-rays there. We are having soon a lab there, So we came from there to now, where now I don't see that many advanced, neglected cases than what we used to see. So that is itself a proof of progress we have made. Then the raising awareness in the community and the population, I have seen organizations forming and growing. You take a first step, and then there are people to follow you, whether they accept it or not, they acknowledge it or not. But awareness came. We started having walks, all those things. Now I'm so happy that our nation, our people know what cancer is, and most of us get screened. Still, there's a long way to go. Cancer Institute had radiation, but we are trying to get brachytherapy unit, which is internal radiation, which we don't have, and patients go to Suriname and other countries, and spend millions of dollars. Government help the patients and subsidize it. It's costing a lot of money. So recently, Cancer Institutes had made a contract, and soon we are going to have brachytherapy. We are trying to raise funds for that. It's kind of 200,000, something like that.
What therapy you call that?
Brachytherapy. Radiation. Radiation is from outside. The other is from inside. The source is, from inside. It's very effective for cervical cancer. Actually, it cures cervical cancer. In a meeting a few months ago with the president, I found him also very interested. He's passionate about, treating those patients who are suffering. And I think they're working on an oncology hospital also.
Yes.
So it is going to be a good milestone soon, when we would have not one but maybe multiple institutions trying to treat cancer patients.
Yes, I do recall the Minister of Health, Mr. Frank Anthony, Dr. Frank Anthony, apologies there, who did make the announcement that there would be an oncology hospital, and that institute would also treat with stroke patients as well,
Yes.
because that is also a growing issue as well, an issue of concern. But Dr. Ghazi, you spoke extensively there about the progress that has been made over the years. But one of the things that we still have to grapple with, the rising number of cancer patients. Based on my numbers, in 2024, Guyana, according to several media reports, recorded about 650 cancer cases. While much progress and work is being done on the awareness side, what, from your experience, are some of the factors you believe still account for the increase in some of these cases?
First of all, the awareness itself.
Mm-hmm.
People are aware and they get screened and they are not staying home denying their disease, and so the diagnosis is made more than before.
Mm-hmm.
One of the reasons is this. Yes, of course, there are this problem was always there, the problem of denial, that I have this problem but I don't want to go to the doctor, because if the doctor find it and if they diagnose it, then me and more than me, my family is going to suffer,
Mm-hmm.
especially women. They are very sacrificing. And when they find that they have something, they try to hide it from the family, so the family don't suffer. And the other thing which keeps the people away, apart from this fear of the treatment and complications of treatment and things like that, is that they would go to these people who would distract them. For example, that's when I told you there's some personal stories. I would not take name.
Mm-hmm.
So this woman comes to me and I say, I scan her and I find a complex mass in her breast, and looking at it, with my experience, mostly when I see a mass, I would know whether it is,
Mm-hmm.
although we do mammogram after that and all those things, but I would know what is going on now with this patient. And I would explain to her, for example, send her for mammogram. Mammogram comes positive, and I tell her, look, there is a high suspicion of you having a cancer which is growing in your breast. And for example, luckily, you don't have lymph nodes in your arms, which would increase the stage, right? And so it is a very right time that we do the final diagnosis by doing a biopsy. Breast biopsy is by this trocar, like a thick needle, and we take a thin little tissue out. We numb the area and put the needle there. But then what happens, she goes home, and the neighbor comes and says, hey, don't do the biopsy. It spreads it.
Wow, so you have that misinformation to compete
or somebody comes and say, no, don't go to this treatment, they will give you chemotherapy and stuff. I know this bush doctor, and he or she treats your breast cancer. And or do the fasting, fruit fasting, vegetable fasting, whatever, and 6 months, and that breaks my heart when I see somebody, beautiful young lady, for example, 40 years, 42 years, and she comes to me and she goes, and 6 months after she comes, and you see those lesions everywhere else, in her armpits, the lymph nodes in her liver. So you can't even do nothing. The only frustration is there. So this is what happens most of the time, that people are, because of this social media and knowledge, sometimes is good, sometimes it's bad. So, you read, okay, these are the side effects of radiation. These are the side effects of chemotherapy. Oh, they're bad. I can't do that, right? But just imagine, you put those side effects in one hand and life in the other. So what are you going to choose? Life, right? So side effects, they are there. For example, if your hair, you lose your hair, the hair are going to grow back, right? But life, it goes, it never comes back. People have to understand that, right? But what happens, the people who are distracting people don't understand that. They murder them. I'm so sorry to use that strong word. But if somebody is distracting somebody from, these treatments are developed after spending millions of dollars or, whatever kind of money on research. Thousands and thousands of hours of research and studies are spent. And then come the treatment where we know what kind of receptors are there. It's advanced now. We know what kind of receptors are there, what kind of chemotherapy should be used to kill those cancer cells. And cancer cells, by the way, when people say chemotherapy kills normal cells, radiation kills normal cells, that's not true. They only target the DNA, because cancer is a disease of sick DNA. DNA is the main unit in the cells, right? Deoxyribonucleic acid. So for people who don't know, that's the main basic unit of our body. It gets abnormal in the cancer cells. And these radiation or chemotherapy, they only attack the abnormal DNAs. They don't do nothing to normal. Yes, there are a little bit of side effects there. There are a little bit of collateral damage, but that is that will be recovered after your treatment is over. But telling people that this is dangerous, it will cause the cancer to spread, biopsy or radiation or chemotherapy is bad. That actually increase the number of cancer deaths which you're talking about.
Wow, so these are all really frightening
I hope I
factors that you have to...
didn't scare you.
No, not at all. But what I'm sure it has done, it has opened the eyes of our audience into the number of things that doctors such as yourself and specialists have to confront as you try to provide the assistance that these patients require. But I want to drill down a bit into some of the categories. In your experience, where do you find some of the prevalent cases of cancer and the types of cancers? In what age groups and genders? What can you tell us a bit about that? Because, for example, what I found in my research is that there's been a spike in cancer cases among children locally. So what insights can you share on that?
I mean, the age incidence, if you talk about breast cancer, for example, with increasing age, the rate, the incidence increases. The cancer, more common in women of higher age than young age. As the age increases, the risk for breast cancer increases. Yeah, there are other cancers like you're talking about children, but I would leave it for the pediatricians to comment on that. But so far as for example, cervical cancer, it is more common, mostly in hinterlands, those populations, depending on their lifestyles. Okay, breast cancer is more in urban population because of the lifestyle again. Breast cancer is common in women who have less children or no children and who are on hormone therapies, hormone replacement therapies.
Breast cancer is more common in
pills,
women without children.
Right.
Okay.
And cervical cancer is more common in women who have multiple children, more than one child, more than one pregnancies, and more than one partners, things like those. So the lifestyle, the age, it matters. For cervical cancer, from the sign of the first sign of the disease, which we find through a test like pap smear, if we can control it, then it is curable. So when people say cancer is not curable, I would confront them and say, no, cancer is curable. The only thing is if you detect it early. Same thing with breast cancer. If you detect breast cancer early, it's curable. I mean, you can find the mass or lump before it spreads into your armpits or anywhere. You did do the whatever surgery you have to do, and lumpectomy or whatever according to the patient case, you're cancer-free. How many hundreds of survivors? Look at that point also. When you say number is increasing, tell me how many survivors are there now. They are 100 times more than what they were used to be years ago. So, that's how it happens. So,
but you noted lifestyle plays a very important
Lifestyle,
role.
what you eat, how you live. Obesity is one of the risk factor for cancers, right? So if you're not controlling your diet, if you're not exercising properly, if you're not watching out, for things which harm you, like smoking is a big risk, right? So fatty foods, canned foods, all of those junk foods outside. I'm so sorry, but deep fried things. You take them and then you drink the colas and things. I don't want to take the names. I don't want to face any suit file on me. But those things, they are the risk factor. People think it's nothing. No, it is. Have a nice walk, brisk walk, early in the morning, brisk walk at night. That only would save you from a lot of diseases. You understand that, right? Eating more greens. When I came to Guyana, I came from Chicago, right? And over there, we used to find Whole Foods and all organic places to eat, right? And when I came here, I found a trend in people using canned foods. They would go to the supermarkets and buy the imported canned foods and love to have it, like whether it is fish or whatever. And Guyana is a so resourceful country for fresh food like greens and fresh seafood and things like that. I mean, I love the healthy lifestyle here. Sometimes I might be cheating also, but majority of the times, that's what I feel. So people have to watch for what they're eating, how they're living. If you live a careless life, partying and doing all sort of things, that is a risk factor, big risk factor. So alcohol is a big risk factor, for liver cancers and things like that, pancreatic cancers. So the lifestyle, how you live and what you're doing plays a very important role.
I know we spoke about women and we touched briefly on children, but what about men? What can you tell us about, what insights can you share with us about the types of cancer, the forms of cancer that you see most prevalent among men, and what are the factors that lead to that?
Let me tell you that number increase. A part is because of the men who think they are machos and they don't want to go to doctors for screening. For example, prostate cancer is the most common cancer after the lung cancer, right?
Prostate is the most prevalent
males, right?
after lung cancer.
Right. So number 2, right? So, but if you tell people to screen themselves, 50 years and above, have to screen every year, okay, for prostate, which involves a test called PSA, the prostate-specific antigen, okay, and which involves ultrasound, which involves some digital examination by a doctor, where you stick the finger and you feel the prostate from behind, inside. The doctors have experience to know what the surface of prostate looks like, and when they feel it's different, then they screen the people who do have suspicious masses or things in the prostate have to go through biopsy, and that's when they don't want to do that, and they run away from that. So there are men who ignore themselves also. Prostate is a very common thing. Normally, most of the prostate enlargements are benign. Benign means they're not cancers. It's just with age, prostate increase in size. From a size of walnut, it could go to a size of grapefruit. So you must have seen old people, with a catheter hanging and a bag hanging, because the prostate has compressed their urinary tract, and so the urine can pass from the bladder to outside, right? So they have to have this catheter. But there are urologists here in our country who are very much capable of correcting it. But if the people deny that they don't have it, and those are the people who develop cancer sometimes, and we can't save them.
And that's partly because of the negligence, their
Negligence,
own
right.
negligence. Okay. And I know that we spoke about the lifestyle for women, but what would be your advice to men?
I mean, there are so many other diseases which are affected by lifestyle. I mean, alcoholism. I already told you that that could cause the liver damage and all kind of liver diseases, cirrhosis, and kind of those things. Um, Smoking. uh, uh, Men tend to smoke more. So if they smoke two packs for 30 years, for example, they are at a high risk of lung cancer. And at Cancer Institute, we had the lung cancer screening also. There's we have a sister organization, Mercy Hospital, Global Imaging. They do the screening for lung cancer by CT. So those men who have been smoking for a long time, two packs at least, 20 years or so, two packs a day, they all have to be screened. So do they do that? No. Then you get patients with that particular cancer. Prostate, I just talked about, is not much lifestyle thing in prostate because it is something, a natural thing.
This happens, yes.
It happens, and nobody knows why in some people prostate grow out of control and becomes develop cancer in it, and why not. But risk factors are again there. Smoking is a risk factor, obesity is a risk factor. So all these things, can cause. So basically, lifestyle have to be a little clean to have a healthy body. That I can generalize it as. What can I say for, the personal habits, hobbies. I don't want to speak a lot about it because, it's everybody's life.
We had on this podcast a few months ago Dr. Mahendra Karpan, Guyana's leading cardiologist, and he expressed concerns about the rise in vaping and concerns regarding this. You noted that lung cancer is the second leading cause of death where men are concerned.
Yeah.
Are you finding this to be appearing in younger men as well?
Again, age plays a strong role in this, right? Cancer don't develop overnight. It takes years.
Okay.
You understand? So I would not say I see young people with lung cancer that many. But yes, the habit which is started at young age could develop into lung cancer later in life.
Okay. Now, there are many signs women and even men can overlook and perhaps ignore and just say maybe they're having a bad day. But what are some of the symptoms men and women should pay attention to, they should not overlook, and it should cause them to say, listen, it's time for me to get screened or get tested?
First one, I would say weight loss.
Okay.
There is a weight loss when somebody gets cancer, right? Not like little, but like reasonable weight loss. Within 4 months, 6 months, you can say that person should be alarmed. Okay, what's happening? If that person is not on Ozempic or something, that's living the same life he was or she's living, and then suddenly start losing weight. That is one of the signs and symptoms. For breast, we recommend self-examination, like physical self-exam of the breast. So if some woman feels a lump in their breast, they should, go to their doctor. Sometimes the unknowingly, like you don't know what is growing inside, so suddenly you see redness or puckering in the breast, or the nipple start retracting, or there is a discharge, pinkish or reddish discharge coming from one of the nipples. That is a sign that you have something going on there. In case of cervical cancer, for example, irregular bleeding, lower abdominal pain, lower back pain, majority of the time, these are being misunderstood. And most of the time, uh, kidney stones are blamed for the pains in Guyana. I get so many patients coming to me and, asking me, hey, doc, can you please check? I went certain place and they say I have kidney stones and I have this problem, lower back pain or, a lower abdominal pain. And when I scan them and see them, there's no stone, right? Or for example, I find a complex mass somewhere in the abdomen, actually causing that pain, or their spine. A lot of us are very hardworking in the back dams, and they work hard in their farms, lifting weight in a wrong way, had a problem with their back, but then they're being continuously given those pills to dissolve the stones which are not there, for example. And sometimes when we find them and we say, you have this problem and um, uh, you're ordering CT scan or something, they're leaving your office and suddenly he stops and says, hey doc, what about the kidney stones? So that misdiagnosis and uh, causes a lot of problems sometimes. For example, in case of prostate cancer itself, you wake up multiple times at night to go to the washroom, but you think that you're drinking more water, so you're going to the washroom. Or, for example, you think you have diabetes. Diabetes also cause increased frequency, so it is because of that. You go to the practitioners. For example, a woman goes to the practitioner for bleeding, postmenopausal bleeding. If the practitioner is not have in-service or knowledge of what goes on with cancers, whether it is endometrial or cervical cancer, would give the hormone pills and to stop the bleeding. And there are incidences. We all sometimes are at fault of delaying the diagnosis, and when the diagnosis is done, it is already too late.
When you say and I want to make sure that I get this clear, you're saying that sometimes doctors misdiagnose symptoms as well.
Yeah, doctors are humans. Sometimes it happens, and we have to understand, until we acknowledge the facts, we cannot improve the system. So some of us need more training, more knowledge, more experience to diagnose complicated things like cancer, which is very common, right? But you miss it very commonly.
Dr. Ghazi, to wrap up our discussion, I know we touched on it earlier, but I just want to bring a bit more clarity to it. While there is scope for patients who may observe certain symptoms and they can get tested and they can get diagnosed, we still hear of cases where patients leave Guyana to go to other territories, the US, even Suriname, to get treatment. Help us to understand why that is. And the reason why I'm asking this question is because I think there is some sort of misconception about what services are actually available in Guyana, what's the capability that we have in country. So help us to put that into perspective.
Listen, we are a young nation comparatively. We are not 200 years old country like America and other countries out there. We do have to realize that we are probably not up to the at par with the facilities there. But one experience which I have is when people go there, their relatives call them, hey, come here, we'll get treated. For example, cancer. Majority of the times, these patients would go there, they would be diagnosed and everything, but then they will spend a long time there. But when it comes to treatment, they couldn't afford the treatment there. They could because they don't have insurance. And there are sometimes they start the treatment and they just can't stay because of their visas and things like that, and they have to come back.
Mm-hmm.
When they come back, sometimes it is already too late. You understand?
Mm-hmm.
So we as a nation or as a country, we need to raise our standards to a level where we can satisfy our people that, you know what, we can take care of you. And that's what we are trying at Cancer Institute. Like I told you that we are trying to get a brachytherapy so people should not go out and get treatment elsewhere in the world. And I wish people would understand it. I mean, you know, it's not a lot of money, but if they can partner with us, you know, the corporates, it's not a lot of money, like 2-3 corporates. Now we are getting so many companies coming to Guyana and helping us out in our infrastructures. And if some of them can just look at this aspect of our nation and, you know, the where we need these things to save lives of our fellow countrymen or women, I would request them to come and talk to us. We have a long way to go, and we expect that people are going to help us in that aspect.
Thank you, Dr. Ghazi. To close, I want to ask you to speak with or speak directly to some of the individuals who may be looking at today's program and they're probably afraid to get tested, or perhaps they are struggling to navigate a cancer diagnosis. What parting words would you like to share with them?
I can only tell you that cancer is not something, like I told you, not curable or a death threat or, it is not something where if you're diagnosed, you're going to die or something. Because if you don't take care of yourself, don't get screened on time, that might be possible at a later stage. But if you get screened properly, as recommended by World Health Organization, PAHO, and your health sector in your country, where we ask you to get screened, for example, the men above 50 to be screened for prostate. Simple blood test, some simple examination can help screen you and save your life. Similarly, women who are 40 years plus can have mammograms every year or every other year, clinical examination, ultrasound of the breast to make sure that there is nothing bad growing in them, because that could save your life. But if you don't, if you're in denial, you say, you know what, why should I waste money on that? Or even somewhere it's free, screening going on, but you say, oh, there is a long line, I don't want to go there. But you are actually putting your life at risk. So please consider it a request, an appeal to you all who are watching this, that please take care of yourself. Screen yourself regularly for cervical cancer, pap smears. They are being done at Cancer Institute. We do it in the West Side. So, that is needed. And together we can beat this monster. Fighting individually, separately, with our own ways, like bush medicine or distractions or, those things, we can't beat it. We have to join hands. So that's what my message is.
Dr. Ghazi, I want to thank you again on behalf of the Starting Point podcast for bringing this level of awareness to myself as well as our team and our audience at home. So I'm sure that everyone has learned quite a lot.
Thank you. Thank you for inviting me here.
To our audience, thank you as well for tuning in. We'll see you next week, same time, same place, with more insights from thought leaders within our landscape. I'm Kiana Wilberg, and I'll see you next time.
Thanks for watching Starting Point. Follow us on Spotify, YouTube, Facebook, Instagram, and LinkedIn for critical updates and exclusive content.